Thank you very much, Presiding Officer. I think, first of all, it says something that Labour have brought forward a motion that is both factually inaccurate and based upon a Daily Mail headline. It does appear to me, therefore, that the journey to becoming Red Tories is well underway. I know it's been a while since Labour were last in power here and also in London, but looking at the record of privatisation in the NHS, I think it's certainly worth reminding them of it. 1999 saw the transition from a public sector provider to include the private sector under the disguise of choice and competition. Then there is the costly PFI contracts, which my colleague Bob Doris touched upon earlier. That's taken hundreds of millions of pounds out of the health budget in profit payments every single year. That money could be and should be going to patients. So when Labour come to this chamber to make a claim that they know is false, they need to be reminded of their distant past, but not yet a forgotten past. As for the Blue Tories being divorced from the reality of life and purpose of the service, it takes a huge amount of brass neck to come to this chamber to make such a claim. Gillian Martin, in her intervention earlier on, actually touched upon the issue regarding privatisation, and the public know that's what the Tories want to do as well. Now, thankfully, I only have 4 minutes, Mr Balfour. Thankfully, this SNP-led government do not agree with either of the aforementioned parties. Now, I'm pleased that the Health Secretary announced, but he didn't need to, about the founding principles of the NHS, that they are not up for discussion. They are free at the point of need. Now, with that, I do welcome the Scottish Government's investment in more than 3,220 healthcare professionals being recruited since 2018, and the Scottish Government is committed to investing at least £170 million a year on growing primary care multidisciplinary teams. But we've heard from the opposition today, Presiding Officer, about costs and finances and cuts. I'm not sure, Presiding Officer, if they understand a few simple economic facts. Brexit has been a disaster. And as I stated in Christine Graham's members' debate last night, and this is really for the interest of Sandesh Gohani, a former member of the Bank of England and Monetary Policy Committee, Adam Posen, suggested earlier this year that Brexit was responsible for up to 80% of the increase to prices in the UK. Inflation is currently running at 11.1%, largely caused by Brexit. Added to this are EU nationals who have left their employment in Scotland, some of whom would have been working in Scotland's NHS. These are undeniable facts that the opposition need to listen to and also accept. Added to this is the current race to the bottom on immigration that both the Tories and Labour are competing on. Do the parties in this chamber not realise that this might actually make it harder to encourage people to come and live and work in Scotland, whether it's in the NHS or in any other aspect of employment? If both of these parties want more money into the NHS, and we would all want more money into the NHS, they need to indicate from which budgets that money is going to come from. Because of the limited finances, because of the limited financial situation this Parliament sadly currently faces. And we've heard from some today about comparisons with the NHS elsewhere. So, once again, for the benefit of Sandesh Gohani, prescriptions are free in Scotland, but are £9.15 in England. Dental care is free in Scotland for under 26s without an opt-in, and NHS eye tests remain free in Scotland in comparison to England and Wales, where they cost £21.31 a time. Also, Scotland has 95 GPs for every 100,000 people, compared to 78 in England, 80 in Wales and 75 in Northern Ireland. So, Presiding Officer, in contrast to this positive progress, in June 2022, the Health Foundation actually indicated about the Foundation UK criticised the UK government's lack of action and said it's unlikely to meet the target of 6,000 added GPs by 2023-24. Presiding Officer, I know that the NHS does have its challenges. It always has done, it always will do. But I know that this SNP-led government are focused and determined to make our NHS stronger for generations to come. Thank you.
Thank you, Mr McNutt.